I'm Ariel.
I'm Callum.
And I'm Caitlin, and we're doing oxycodone, also known as Oxycotin. Oxycodone is a opioid, which is a Schedule II drug. Opioids include illegal drugs, synthetic opioids such as fentanyl, and pain relievers that are prescribed by doctors.
The method of action, it binds to opiate receptors in the central nervous system and alters perception of and response to painful stimuli while producing generalized CNS depression. For therapeutic use, it's used for pain relief, also usually prescribed after oral surgery such as wisdom tooth extraction, and also helps with chronic pain due to certain cancers.
The side effects of oxycodone, there's a bunch of them. So in the CNS, you have confusion, dizziness, headaches, sedation, dysphoria, euphoria, floating, sweatings, and hallucinations. The cardiovascular, you have issues with your heart and your circulation on those, and it turns to orthostatic hypotension. You have issues with your skin as well as a side effect in the integumentary system, including flushing and sweating on those. There's another one in the endocrine system with adrenal insufficiency. Then you have your casual GI issues with constipation, nausea, vomiting, etc. You have GU issues with urinary retention, and then respiratory depression on those. Some of the patient teaching on the Oxycontin, you have to take it orally on those, and it can be given with milk or food to avoid irritation in the GI. It can lead to physical and psychological dependence. It's a very addictive drug. That's why it's not prescribed too much in high quantities. Don't drink alcohol with this. You'll have some issues with that as well. It can cause fatality or even very huge GI issues on those. I'd advise a patient to move slowly on those because it is a sedative. You could fall and have other injuries from it as well.
And the nursing assessment is assess the respiratory rate and blood pressure prior to giving the medication and periodically after giving the medication, just to check for a drop in their respiratory rate. Assess the type, location, and site of pain prior to giving the medication. Monitor their bowel movements in case they get constipated. Assess the patient for an abuse risk, like if they would illegally use the drug or use it for something other than for their pain. Make sure you're giving the correct medication. There's long acting and short acting. Short acting is for acute outpatient therapy, and long acting is for chronic pain such as cancer and stuff like that. And it acts better if it is taken on a schedule rather than PRN.